Thank you for joining us today for the Norton Cancer Institute Sexual Health Program class. Our goal for this class is to help ease any emotions you may have before, during, and after a cancer diagnosis and treatment in regards to your sexual health. My name is Laila Agrawal, and I'm a medical oncologist with Norton Cancer Institute and also specialize in the unique sexual health needs of cancer patients. This class is designed to help answer any questions or concerns you may have about your sexual health. So let's begin and talk about sex and cancer. Why is this so important? Sexual health is part of your overall personal wellness. How you take care of your health, including your sexual health, can make a major difference in your quality of life. We support awareness, education, and empowerment about your sexual health. First, thank you for choosing Norton Cancer Institute as your healthcare provider. We strive not only to care for the body, but the person within, and hope that you feel comforted knowing that services such as the Sexual Health Program are available to you throughout your cancer journey. According to the World Health Organization, sexual health is fundamental to overall health and well-being of individuals, couples, and families. This is important not only in the reproductive years, but throughout the individual's lifespan. So I think it's important to start with this point, which clearly says that sexual health is an important medical issue and is important to your overall health and well-being. Treatments for any type of cancer can affect your body's sexual response, your interest in sex, and whether it's safe to have sex. Cancer treatments such as surgery, chemotherapy, radiation treatments, stem cell transplants, or hormone blockers can cause physical and emotional changes that affect your whole life, including your sex life. You may notice changes in body image, your interest in sex, or your ability to take part in certain sexual activities. Now, talking about sex can be a sensitive topic for some people. It's important, however, to discuss how cancer and cancer treatment can affect sexuality and how to treat issues that may develop. There are four main areas when addressing sexual health and cancer: biology, psychology, sociocultural topics, and interpersonal topics. I'll do a general overview of these four areas, and then we'll get into the details of each later during the class. So in this model, multiple different domains come together to affect somebody's sexual function. Let's take a look at biology. Biological hormonal changes can result from estrogen reduction. Anatomical changes, such as vaginal atrophy or stenosis, can also occur. These can happen as an effect of surgery, for example, women with gynecological cancers, or from estrogen reduction or loss of a body part. If you've had breast surgery, you may have experienced loss of one or both breasts, meaning there could be loss of sensation in that area. Pain and fatigue can be a side effect of cancer treatment as well. And so there's medical interventions that can be done to address these biological changes, such as medical treatment, specialty evaluation, and pelvic floor physical therapy. Going through cancer and cancer treatment can certainly cause mental health disruption, including anxiety and depression. And in addition, the way people think about their body image through cognition and negative thinking can also happen. Cancer can affect motivation, so treatment here involves counseling or even cognitive behavioral therapy. The sociocultural domain includes religious beliefs, cultural values, and social norms, which all play a big role on how individuals perceive sexual functioning and their own sexual efficacy as well. In the interpersonal domain, relationship problems, including lack of communication and a fear of intimacy, can come about. A great way to address these issues can be through couples therapy or group counseling sessions. For patients with breast cancer or other types of cancer, symptoms of low estrogen can come about because chemotherapy may induce early menopause, or treatments such as hormone blockers can cause low estrogen. In terms of sexual functioning, this has many different impacts, including low libido, bladder infections, joint aches, night sweats, mood changes, worsening of anxiety or depression, insomnia, pain with sex, mood swings, not to mention infertility and vaginal dryness. Long-term sexual health problems can be seen in patients with breast, gynecological, colorectal, or other cancers. In fact, it's reported that 45% of breast cancer survivors and 55% of patients with gynecological cancers can experience pain with sex. Another study done in 2020 took a look at over 400 cancer patients. 81% were female, and concluded that 87% of patients said that cancer treatment impacted sexual function or desire. We now know that sexual health is the third most common concern among cancer survivors. So please know, if this is you, you are not alone. We are here to help. Now that we've established how common sexual health concerns are during, before, and after cancer treatment, I want to empower you to talk to your doctor if you have any concerns with your own sexual health. There's no reason to be embarrassed or feel that your concerns are not valid, because they absolutely are. It doesn't matter if you're married or unmarried, if you're part of the LGBTQ community, or if you're young or young at heart. Please know that we're here to help care not just for your body, but the person within. Let's talk through some of the more specific concerns you may have in regards to your sexual health. You may currently be undergoing chemo or have had chemotherapy in the past. Chemotherapy side effects can include early menopause, including loss of fertility and symptoms such as vaginal dryness, pain with sex, hot flashes, or decreased desire. Here are some topics you can discuss with your doctor. Is there a need for pregnancy prevention during my treatment? What types of sexual activity are safe? What type of protection is needed for me and my partner? Note that chemotherapy may prompt special instructions from your doctor if your gynecological or other organs need to heal, if you are susceptible to infection, if there's risk of severe bleeding, or you could become pregnant. Surgery to remove cancer can sometimes mean loss of a body part, like we mentioned a few minutes ago regarding mastectomies. Some examples of this can include surgery for gynecological cancers, which can leave vaginal canal scarring or narrowing, which is also called stenosis, and pain. Removal of the ovaries can cause early menopause. Breast removal, even with advancements in plastic surgery and reconstruction, can leave a loss of feeling or sensation in the breast that can affect arousal. Mastectomy can also change the way a person feels about their body. Other cancer treatments, such as treatments for colon cancer, may require a colostomy, an artificial opening in the abdominal wall that can also affect feelings about sexuality. Now let's discuss radiation treatment and sex. Radiation for gynecological cancers can cause the vagina to narrow and shorten, which can lead to pain during sex. It can also leave scar tissue, making the vaginal tissue less elastic. Prevention and treatment can include progressive vaginal dilators and pelvic floor physical therapy. These treatments can be more effective if started early. Radiation to the head and neck can change production of saliva, which can affect kissing and oral sex. Radiation treatment can leave the treated area tender for a few weeks, and sex can trigger some light bleeding. Pelvic radiation often causes infertility, but you should consult with your cancer care providers before stopping birth control. If you're taking tamoxifen or other hormone-blocking breast cancer treatments, you may experience menopausal symptoms that affect sexual intimacy. Side effects can include vulvar and vaginal dryness, thinning of vaginal tissue, decreased libido, hot flashes, and night sweats. Vaginal moisturizers and lubricants may help relieve some of these symptoms. Let's talk more about vaginal moisturizers and lubricants and how they can help. Vaginal moisturizers and lubricants are two separate products that are used for separate purposes. So, vaginal moisturizers are used on a regular basis to maintain vaginal and vulvar moisture and the health of the tissue, regardless of sexual activity. You can use these vaginal moisturizers minimum of 3 times a week, but up to 5 times a week or even daily in order for them to be most effective. Vaginal lubricants help reduce friction and relieve discomfort with any type of sexual touch or with vaginal penetration. There are a number of different vaginal moisturizers that can be recommended, purchased at a drugstore or online. There are also natural moisturizers that are available. For example, coconut oil is a natural oil, and it comes in the form of a solid. It will melt into an oil with just the right warmth of the body temperature, and it can be applied externally to the vulvar tissue. A lot of patients seem to prefer coconut oil as a vaginal moisturizer. You may be at higher risk for yeast infection if you use coconut oil, so be sure to discontinue it if this happens. Olive oil is also a great moisturizer. It can be applied using fingers in the vaginal canal. Vitamin E capsules are capsules that can be broken open and applied to the vagina. These oils may stain the undergarments, so be aware of that. Luvena, Replens, Hyalogyne are all examples of commercial moisturizers that can be used. When using commercial moisturizers, it's important to look for products that are glycerin-free and paraben-free. These can be irritants and cause dryness. A number of commercially available moisturizers also contain hyaluronic acid, which can improve the effectiveness of that moisturizer. Vaginal lubricants are used to reduce the friction with any type of sexual touch or vaginal penetration. Lubricants work to reduce the friction or pain caused by rubbing against dry and thin vaginal tissue. Lubricants can be oil-based, water-based, or silicone-based. Water and silicone-based lubricants can be used with condoms. Oil-based lubricants can make condoms less effective. Do not use petroleum jelly or baby oil as a lubricant. Oil and silicone-based lubricants can stain sheets. If you're concerned about staining, place a towel over the sheets. Silicone-based lubricants can damage silicone sex toys. Lubricants that are flavored, tingling, warming, or contain glycerin can cause vaginal irritation. Note that moisturizers and lubricants do not protect against pregnancy and sexually transmitted infections. So, what are local hormones? Local means the treatment is applied directly to the affected area. There are several local hormone options available, and they come in different forms such as creams or inserts. Talk to your doctor about using local hormones to see if this would be appropriate for you. There could be concern that hormones can be absorbed into the bloodstream, causing an increase in hormone levels. You may be wondering about toys and what is considered safe during cancer treatment. Vibrators are actually a great tool to improve your genital health and increase blood flow to the vagina. This is important because the effects of cancer treatment can cause reduced blood flow through low estrogen to the vagina. Now let's talk a bit about the pelvic floor. The pelvic floor consists of a group of muscles seen here in this picture that help lift and support your pelvic organs. This includes the bladder, vagina, and rectum. One reason you may be experiencing issues with sexual health is due to pelvic floor dysfunction. Your pelvic floor can be either underactive or overactive, and I found that many of my patients experience an overactive pelvic floor. An overactive pelvic floor may mean that your pelvic floor is having trouble relaxing and is always contracted. This can cause pelvic pain syndrome. You may be walking around with an overactive pelvic floor and not even know it. If you're experiencing pain with penetration, incontinence, constipation, pelvic floor physical therapy may benefit you. At your first pelvic therapy visit, your therapist will review your history and do a musculoskeletal examination, focusing attention on the hip and the lumbar spine. The reason for that is that the external muscles in the hip and around the spine contribute to the action of the pelvic floor. They need to be considered as a whole. If it's appropriate and you're comfortable, your therapist can do an internal exam as well and can identify trigger points or tender points in the pelvic floor musculature, as well as assess for the tone and the strength. Interventions can include manual therapy like stretching or trigger point releases. Connecting to the pelvic floor and using techniques such as deep breathing and yoga can also be beneficial. You can also use tools such as dilators or trigger point wands to help manage your symptoms at home. Body image involves your perception, thoughts, behaviors, and emotion related to your body. It's more than just your physical appearance. Cancer and cancer treatment can cause physical changes that affect your body image. Many of these changes can also be linked to how you view your sexuality. Body image concerns are common after cancer treatment, and they can come up at different times. There are ways you can address body image concerns. Talk about body image concerns with family and friends. Ask them to listen, not to give you advice. Wigs, scarves, and hats can help you cope with hair loss. A wig can be prescribed by your medical provider and may be covered by insurance. Norton Cancer Institute resource centers also may have wigs as well. Breast prostheses and specialized bras can be prescribed by your medical provider after breast surgery and may be covered by your insurance. Counseling can be very helpful in restoring a positive body image. I hope you found this class helpful and empowering. Remember that your care team at Norton Cancer Institute is here for you during every step of your journey. To learn more about our sexual health program, you can visit nortoncancerinstitute.com or call 502-629-HOPE. Thank you for attending this class and for choosing Norton Cancer Institute for your cancer care.